Yeah, it is very interesting that I learned about this mainly, first of all, from Phyllis Cunningham, one of the nurses, that such a large percentage of black children in Mississippi were delivered by midwives. And one of the things that she did, and later on they did in the health center in Mount Bayou, was to offer training to midwives. The problem was that the midwives were right in the middle of a blaming game. That by law they were not supposed to deal with pregnancies, with births that were going to have complications. But very often doctors would not come out when they were needed. So these babies would die, and of course the midwives would get blamed for not doing what should have been done. There were all sorts of paternalistic kinds of, really, well, I'll give you one example. One midwife told Phyllis that when they were going to these meetings where their white superiors were instructing them, that they had to sing little songs like "This is the way we wash our hands," that were just so demeaning. And with this, and of course, as Elsie Dorsey has written on several occasions, they were delivering among the poorest of the poor. And I think she said that, I don't know which was more valuable, the part of the hog or part of the cow, but depending on whether you delivered a boy or a girl, why you would respond in kind, bartering for payment. So it was, they performed an enormously important function when so many people had never been to a hospital, seen a doctor. But then they start gradually to decline in the late 1960s. And as Medicare and Medicaid, or especially Medicaid, of course, in this case, became available, why physicians and hospitals began to take over this function. But as we saw last year in the New York Times, why there was a great increase in infant mortality, especially in the Mississippi Delta, because this thing fluctuates depending on the availability of sources and the educational programs that are there. They were in the same building on Lynch Street. And I asked that question, and they, at times they would work together on cases. They would be the equivalent of expert witnesses. But mainly, the lawyers, of course, were in Mississippi much longer for the long haul, and there were 4 or 5 different legal organizations. And we do need one book that really talks about that story there, because they were so important. But for the time they were there, they were, they had lunch together, they shared a common background as professionals and being older, but I couldn't see that they were working in tandem that much in terms of legal issues or medical issues.
I'm wondering if you have any theories as to why this aspect of the movement was overlooked or forgotten for so many years, and what other areas were in danger of omitting.
That is a good question, and I have 5 minutes tonight. I'm in with a bunch of medical experts, and I'm going to be totally overwhelmed. So I got my 5 minutes is going to be on this, I think. How did you get involved in this, and what do you make of it? And well, I'll start with Poussin's comment. He said, "I could not understand at the time or now why civil rights activists spent all this time picketing Woolworths and other public accommodations. They should have been throwing picket lines around hospitals, because blacks were dying because they couldn't get into them, and they were dying if they did get into them because of inferior segregated care." I did not write about health care in local people. One of the reasons was that it didn't come up much among the activists. And then when I look back at my own education as a 20th century social and political historian, in the mainstream books there wasn't much about health care. I mean, I have a whole section here on the efforts under the first Nixon administration to get universal health care passed, in which Ted Kennedy put forth the single payer bill that is now House Resolution 676. I never talked about that when I talked about Nixon. And if you look at the books, you won't find much about it either. I think healthcare has been, under the screen, that historians have really not done their job in incorporating that story into our mainstream narrative, whether it's civil rights or other kinds of history during that time. And I'm hoping that at least with the emphasis we have now, that might change. I think one of the things is that we don't talk about it in the schools. We're finally getting around to talking about the civil rights movement to kids, but healthcare is something that, other than personal hygiene, there's not that much. So I think that we as scholars have an obligation, and that certainly the people doing curriculum work in the schools have to do that too, because it just is something that is apart from everything else, and yet it's central. Resolutions, were passed opposing it. I mean, that was very clear that they took a stand against it. They were not, they had a number of task forces. I mean, that was not a task force. What they were most interested in was dealing with things such as one of the state mental hospitals in New York was inculcating mentally challenged young people with with disease to see if the cure would, if the shots would cure it. And which was, akin to saying these people are marginal. If they die, it doesn't make any difference. But no, they took the stand, but they were not actively involved in that campaign. As far as I know, I mean, local chapters were doing different things, and I didn't get around to all of the local chapters.